The White House says it plans to end emergency COVID-19 declarations in May. And this move means an end to free testing, treatment, and vaccines. The original actions taken by the Trump administration provided funds and resources to federal agencies to help deal with the COVID-19 pandemic. Joining us now is Dr. Dean Winslow, infectious disease specialist with Stanford Healthcare. Doctor, thank you so much for joining us. Do you think this is the right time to make this move?
Yeah, my big concern, is that this may have the biggest impact on people without health insurance. Again, the government was purchasing these wonderful messenger RNA COVID-19 vaccines for about $30 or $40 a dose. And the rumor is that the vaccine going forward will cost $85 to $120 a dose, assuming that it's paid for individually by either health insurance or individuals' private pay. So again, my big concern is really the impact that this is going to have on those who don't have insurance, which also are the same people that were most heavily impacted by the COVID-19 epidemic, that is, communities of color and other folks that, come from socially vulnerable environments.
I want to get back to that in just a moment, but I want to talk more about kind of the health implications of this. I mean, is the country ready to kind of move out of this pandemic phase and into a more endemic phase in terms of if you're looking at the numbers with people actually catching COVID and actually winding up in the hospital?
Yeah, so I think we're in a much better position right now than we were certainly a year ago this time when cases of Omicron were really surging all over the United States. So we are in better shape now, but again, this virus has fooled us so many times with emerging variants. So, I really don't think that we're out of the woods yet. And again, my big concern is that this program, has just been so successful, but we really do, have a long ways to go. And as I said, my big concern is that individuals from communities that have already been disproportionately affected by COVID-19 may really be the ones bearing the brunt.
Do you feel like this is a little bit of mixed messaging too, in that everybody's encouraging you to go out and get the vaccine, get the treatment, take precautions, but then in May they're going to say, yeah, go out and do that. And by the way, you're also going to have to owe $80 for this vaccine, and you're going to have to do it every 3 months for these boosters. I mean, we don't really know yet what the next protocol is going to be, right?
Yeah, it's probably going to be, once a year is the schedule most likely for a booster, which will be hopefully kind of tailor-made to the variants that have been predicted to circulate. But having said that, I think everybody who's listening to this program, I just highly, highly recommend that you go ahead and get your bivalent COVID-19 booster as soon as possible, preferably before May 11th. Again, if you have not had a booster within the last 6 months.
Do you think there's kind of a happy medium that the Biden administration should really be a proponent of, and that they should maybe pay for the vaccine, but maybe some of the treatments and other things like that should be covered under insurance? Do you think that there's a kind of a way to bridge that gap there?
Well, again, I think that one of the reasons that the Biden administration requested that the end of the pandemic be extended out to May 11th was to allow, some of these sorts of decisions to be made, again, by private insurance, as well as other, agencies within the U.S. that are responsible for healthcare. But again, my real big concern is just that in a way that the chaos that may result from withdrawal of this federal funding really points out, I think, some of the systemic problems that we have in our healthcare system and how we pay for healthcare in the United States.
Do you worry that if more people have to pay for things like vaccines and treatments that those COVID numbers could tick back up? Is that a real risk by doing this?
It certainly is possible. But again, as a clinician, my big concern is actually just for the welfare of individual patients. And again, vaccines, while they're not 100% effective in preventing infection, they're incredibly effective in preventing serious infection, hospitalization, and death from COVID-19. So, again, big, strong recommendation to get your booster now if you haven't had the bivalent booster yet.
All right, Dr. Dean Winslow with Stanford Healthcare. Thank you so much.
You're quite welcome. Thanks for the good work you're doing.